Awesome. Thank you, Dwight. And I'm going to go ahead and share my screen. Bear with me. Awesome. Thumbs up if you can see my slides. Very nice. Awesome. Well, thank you everyone for taking the time to join us for our panel session today entitled How WIC Met the COVID-19 Challenge. I'm so excited because I think we have a great panel bringing together a diverse range of perspectives on this very issue. Our goal is to make this feel as conversational as possible. So as Dwight said, please don't be shy about popping questions into the chat box. I'll be trying to monitor that as closely as possible over the course of our conversation today. So with that, let me move to my next slide. There we go. A little bit about me. Hi, I'm the moderator. My name is Yates-Berg. I'm a vice president at Ideas 42. Ideas 42 is a nonprofit behavioral design lab. We use insights from behavioral science to do good. And I specifically focus on our anti-poverty work here in the US. We call it our economic justice work. As I said, today I'll be playing the role of moderator. So I'll be the conductor of this panel. It's my first experience moderating a Zoom panel, so I'm super excited to be doing so, but please feel free to be easy on me over the course of our panel today. A little bit more about Ideas 42. Given that the pandemic, of course, has a very behavioral nature, we have written pretty extensively about the use of behavioral science in addressing concerns that have risen in the pandemic, including thinking about ways to address food insecurity and to innovate in public benefit programs. So I'd invite you to check out our website, www.ideas42.org, to learn more about the work that we do in our pandemic response work in particular. But I wanted to start off today's panel by centering us on the problem at hand, which is not going to be a surprise to anyone that the pandemic has had a disproportionate effect on people living with economic hardship here in the US. And the rise in food insecurity over the course of the pandemic is just one of the manifestations of this hardship. The Special Supplemental Nutrition Program for Women, Infants, and Children, otherwise known as WIC, plays a vital role in helping families, particularly families with young children, address food insecurity issues. And importantly, in the topic of today, WIC has made adaptations and innovated its programming over the course of the pandemic to make it both safer and easier for families to access its programs and services. So today, as I mentioned, we'll hear from a diverse range of perspectives about how WIC met the food insecurity challenge, from a high-level policy perspective to boots on the ground, and hopefully we'll walk away with some ideas of places where there are challenges and of course new opportunities for WIC to address food insecurity here in the US. So quick reminder that if you want to ask questions, feel free to plop them in the chat function, and don't be shy about that. I'll be attempting to moderate that over the course of our panel discussion today. But before we dive into that, I wanted to do a quick interactive activity. For those of you who are familiar, there is a function, or not familiar, there's a function on Zoom called Annotate that you can use to write on a shared screen. You can draw, you can, there's shapes, so you can heart different things and star different things that people write. So would love to hear from you. And please don't all write in the upper left corner of the screen, but feel free to put down some thoughts. What do you hope to get out of today? What do you hope to learn? However you want to express yourself, feel free. I'll give you a couple moments to do so. And it's anonymous too, so don't be shy. And if people are figuring out, we can give it a little more time too. All right. And if people don't want to participate in this, that's totally, oh, nope, we got a squiggle. Maybe people are just figuring it out. There we go. What?
I don't know, Allie, this is Elyse. I don't know if you have to go to view options at the top, and there's one of the like at the very top of your screen, and then you can click annotate, and then you get the options. Or so
Okay.
at least on some people's screen, it might look like that.
Okay, that's helpful. You can also type to text more knowledge. Awesome. Well, we can move on, and as people figure it out, we all don't have those controls. Okay, that's all right. We'll keep on. Oh, here we go. Looking forward to hearing how the program has changed. Yeah, definitely. We'll cover that today. We'll give it another 10 seconds. How it can be strengthened going forward. Great. Awesome. So I will take a quick screenshot of this to save. And I think these are all topics that we'll be able to go over today around, you know, how WIC can be strengthened going forward, sort of within the pandemic and hopefully beyond. Looking forward to hearing how the program has changed. And then, yes, I think we'll definitely be able to speak to some of these issues from both a national and a local perspective. Great. So let me go ahead and clear this. Hold on. Sorry about that. All right, so let's keeping on. All right, so brief overview of our agenda today. I'll start with a quick introduction to our panelists. They'll give some very brief opening remarks because we do want to leave a lot of room for conversation. And then we have some prepped questions, or I've prepped some questions for our panelists to have a discussion. We'll then open it up, of course, for some more intentional time for audience questions, and then leave some room for closing thoughts at the end. So today's panelists, I'm super excited to welcome at start, Brian Dittmeier. Brian is the principal policy staffer at the National WIC Association, which is a great association of WIC providers. Brian brings his experience advocating for WIC's programmatic priorities and public health mission to both his work and, of course, our panel today. So welcome, Brian, to today's panel. We are also joined by Madeline Curtis. Madeline is a senior policy associate for the American Academy of Pediatrics, where she advocates for a broad range of child health policy issue areas. And Madeline is going to help us understand the important health benefits of WIC today and the ways that pediatricians can effectively collaborate with the program. So welcome, Madeline. And we also have Katrina Harwood. Katrina is the public health supervisor for the Public Health Madison and Dane County. Katrina brings a really important perspective to our panel today. She's a little bit more boots on the ground, and she can speak to the impact of the pandemic on the local agency context. So welcome, Katrina. And finally, we have Elyse Kovalsky. Elyse is a senior manager of program innovation for the No Kid Hungry campaign at Share Our Strength. Elyse brings an innovation and human-centered design skill set to our panel today. And we'll be speaking today for us about the WIC shopping experience improvements, especially as it relates to online ordering and purchasing. So welcome, Elyse, as well. And so with that, let me go ahead, and I know I've talked a lot and you want to hear from our panelists. Let me turn it over to Brian to give some opening remarks. Brian, I will plan to mute myself and steer the slides, but feel free to dive into these and just tell me if I'm moving too slow on the slide progression. Thanks.
Thank you so much, Allie. Hi, everyone. It's a great honor to be here. Thank you so much to the conference sponsors for spotlighting WIC. As you know, representing the National WIC Association, we could talk forever about WIC. I'll try to be as concise as possible, though. But you know, I think that over the last 10 years, for those of you who have been following WIC since the height of the Great Recession in 2010, we've been seeing challenges in the program administration because of antiquated regulations going back to the 1970s and a very 20th century model of clinic-based services. We have seen that the program has not been able to adapt to modern challenges, the schedules of working parents, transportation issues in both urban and rural settings, and unfortunately had been seeing a decline in participation and frankly in the percentage of eligible folks who have been participating in the WIC program as well. Most notably, we've seen a decline in participating children and toddlers around age 2 to 4 in the program, which is that decline was happening concurrently with changes to the food package that made it healthier and actually started to tackle childhood obesity and other early childhood diet-related conditions. And so we know that as WIC is only improving its ability to shape health outcomes, we are reaching fewer and fewer of the eligible participating population. With all that being said, the COVID-19 pandemic has dramatically reshaped the program. And if we go to the first substantive slide, we'll see that, that WIC providers have really stepped up in this moment and have been able to adapt in record time to retool and redeliver WIC services for a modern age, and particularly attuned to the unique public health implications of COVID-19. So under the Families First Coronavirus Response Act, thanks to NWA-led advocacy, partnering with AAP and ACOG in particular, so thank you so much, Madeline, we were able to secure waiver authority for the first time in the WIC program. And I think that's an important piece to keep in mind is that, WIC is, unlike other programs, it has a particularly prescriptive statute. And so Congress has to be responsible for making a lot of the changes, and USDA lacks the flexibility in WIC that it may have in SNAP and other nutrition programs. So this waiver authority was a significant step forward for the program and being able to adapt to meeting the needs of families during COVID-19. I won't go into all of the different waiver flexibilities that have been achieved, but one of the most significant ones has been the ability to alter the certification appointment, to delay testing and health assessments that had to happen in person, and to conduct the remainder of the certification appointment either by phone or through video conferencing. It has been transformative for the program and has been cited by a number of new participants as a flexibility that has secured their ability to access WIC in the first place. I'm sure it's something that Katrina will talk about later in the presentation, so I won't belabor the point too much. But it should be noted that not every state and not every clinic has been able to avail themselves of remote operations. And so here on the right, you see a very innovative model in New Mexico where participants had to reload their EBT cards in person at the clinic. And so to keep, reduce exposure and keep families from having to expose themselves to the WIC staff and additional folks in the health facility, these rovers were adapted to collect the EBT card, be steered back into the clinic, reloaded, and then returned to the family after being sanitized and cleaned as well. So, agencies are innovating and adapting both in person and with technology to reshape the certification appointment to bring new families onto the program during COVID-19 and to meet the need that's out there, both the pre-existing need and the new need given changes in economic circumstances. If we go to the next slide, another area I want to touch on real briefly is the shopping challenges. So I'm sure all of you were familiar in that first few weeks of March and April, the mad rush to collect everything you needed in a grocery store and hunker down. I think toilet paper was perhaps the number one covered product at the time, but there were certain challenges with accessing infant formula and WIC staple foods during that time as well. And so through the waiver authority, we have been permitted to provide food substitutions, and USDA has wisely actually leveraged these food substitutions in a way that's consistent with the nutritional integrity of the food package, allowing for additional package sizes and brands without venturing too far into offering, white bread and other foods that would start to compromise the nutritional integrity of the food package. And so those additional options we hear even today. I was just on the phone with WIC providers in Washington State, and they're seeing another rush of folks going and buying products and shortages on the shelf. And these food substitutions remain vital and necessary even today. One of the pieces where USDA has not been able to innovate, and if we remain on that prior slide, has been around offering online purchasing solutions. And we've seen this scale up very rapidly in SNAP with a national model that was available, of course, built on 5 years of behind the scenes work at USDA. So it was primed to be ramped up in this moment. But for WIC shoppers, no similar technology exists. And so NWA has been coordinating conversations between retailers, technology partners, and WIC agencies to move this conversation forward. But frankly, USDA needs to be at the table. There's bipartisan legislation that would convene a task force and issue recommendations by September 2021 to push this forward. And our goal is hopefully to have online purchasing available in every state by at least 2025, although we need USDA to be a partner in this effort. And we know it will take time and not be responsive to the immediate needs of families during COVID. So that is really, I think, one of the major issues coming out of the COVID era is moving forward online purchasing and more convenient shopping options for WIC families. And Elyse, I believe, will speak a bit more about that later on. Another piece to also just assess is, the impact on caseload and how folks have been utilizing WIC during the COVID-19 crisis. One of the challenges is that, in the matter of just a week or so, WIC agencies have been able to remake how we interact with participants, have implemented these remote certifications, but they were all tied to the waiver authority. And over the course of the spring, summer, and early fall, USDA was quite intransigent in adopting a month-to-month model, in pushing agencies to reopen. And unfortunately, some states, due to policy decisions, have decided to reopen their clinics, which has actually only put WIC staff in jeopardy as they were exposed to the virus and had to close down clinics. Thankfully, in September of 2020, there was an agreement struck in Congress, and USDA came to the table, and those waivers were extended in the long term, tied to the public health emergency declaration, which is what we had, of course, advocated for since the beginning. As those disruptions happened, I think it has had an impact in certain states as far as messaging and being able to reach out to participants and let them know that WIC was an option during the pandemic. But now we can have a clear message that while WIC doors may not be open, WIC services are open and ready and available for folks throughout the pandemic. Despite these disruptions, the majority of states have seen increases in their caseload, which I should note, after 10 years of decline, is a significant change in trends, and we are excited to see that. Anecdotally, most of the new families coming in are frankly families that were previously eligible. And so we are finally reaching those folks who had been in our sphere, in our range of outreach, but are now feeling mobilized to access WIC services. Some states, they're listed there, have been reporting double-digit increases since February of 2020. And that's quite significant. But it should be noted that there's a handful of states as well that are reporting declines in participation. And many of those states are the ones that couldn't ramp up technology options. So that's a key trend to be aware of as well. With all that being said, I think changes in certification, adopting telehealth strategies, outreach to families, and then of course, streamlining the shopping transition and solutions, all of that requires additional action in Congress to operationalize in the long term. And so, we're hopeful that in 2021, we'll see a child nutrition reauthorization that can leverage all of these much needed, long delayed reforms, push the program forward into the future and set a new tone for the decade of the 2020s. But it's going to take all of us in the anti-hunger community to come together and to say that this is needed before a farm bill, that it should be a priority, and that in addition to changes on the school side, that, in order to modernize WIC, Congress needs to play its role. So I know that was a lot to cover. I don't want to delay too long from my other co-panelists. My information is, of course, there. I look forward to the conversation. And thank you again for having me here.
Thanks so much, Brian. I think that was a great overview, really set the stage for our other panelists and for our discussion today. Without further ado, I'd like to introduce now Madeline Curtis. Madeline, do you want to say a few words?
Thank you so much for the opportunity to speak with you all today. As Ali said, I'm Madeline Curtis, and I'm the Senior Policy Associate for the American Academy of Pediatrics, or AAP, which is a nonprofit professional organization representing 67,000 pediatricians. So I'm not a pediatrician, but pediatricians know that children who live in households that are food insecure are likely to be sick more often. They're likely to recover from illness more slowly and to be hospitalized more frequently. And the lack of adequate healthy food can impair a child's ability to concentrate and perform well in school. And it's linked to higher levels of behavioral and emotional problems from preschool through adolescence. Maternal and prenatal nutrition and the child's nutrition in the first 2 years of life are really crucial factors in a child's neurological development and then their lifelong mental health. And child and adult health risks, including obesity, hypertension, and diabetes, may be programmed by nutritional status during this critical period, often called the first 1,000 days. WIC is the most important program providing nutritional support in the first 1,000 days of life. In providing nutrition support and linkages with healthcare, WIC builds good health and promotes resilience in families at risk, which helps to mitigate the effects of toxic stress. One of the most effective investments that the federal government can make during childhood is to support and reduce barriers to accessing WIC. WIC plays a really important role in promoting breastfeeding through the successful Breastfeeding Peer Counseling program. And children who receive WIC have improved birth outcomes, increased rates of immunizations, and better access to healthcare through a medical home. Moreover, WIC reduces healthcare costs. These are just some of the reasons why pediatricians are really big fans of WIC. And as COVID swept across the United States and even more families started struggling with food insecurity, the access to nutrition support provided by WIC became even more important. The waivers provided by USDA that Brian was talking about that allow for remote enrollment, services, and benefits were crucial to helping families in need. And at AAP, we think many of those flexibilities should be made permanent, allowing for remote participation in the program and giving states the option to eliminate recertification at age 1 would really ease existing burdens to participation. And similarly, extending WIC eligibility to age 6 would address that age gap for children who have not yet started kindergarten. In order to enhance the WIC participant experience and to improve communication and collaboration between WIC and medical providers, we think that USDA should initiate some sort of pilot project to test the feasibility of a national system or a database that permits WIC staff and medical providers to share health-related information. And we think that Congress and USDA should promote models such as co-locating WIC clinics with medical providers. Co-location, which is when a WIC clinic is in the same place as a medical office, really fosters high levels of coordinated communication and collaboration between WIC and primary care providers around things like nutrition education, breastfeeding, and obesity prevention so that WIC participants receive consistent advice from WIC and from their healthcare providers. I look forward to discussing these opportunities as well as other ways WIC and the healthcare system can work together with the rest of the panel during the discussion.
Wonderful. Thank you so much, Madeline, for that great overview. I'm going to turn it now to Katrina to give any sort of opening remarks or words before we dive into discussion.
Good afternoon, everyone. It's great to be with you, even in a virtual setting today. As Ali mentioned, I supervise a local WIC program in Madison, Wisconsin, so I'll be sharing a little bit about our experiences with the waivers from a local program. Our local WIC program is housed within our local health department, which has meant that some of our program staff in WIC, including myself, have also been supporting our COVID response. Many WIC programs across the country are housed within health departments, and therefore the pandemic represents such a unique challenge in program administration. Because we were torn a little bit between getting the WIC program back up and running and then also helping to slow the spread of COVID-19 in our community. Our program closed for in-person appointments towards the middle of March. In the time between closing our clinic for in-person appointments and having the physical presence waivers, we were able to provide benefit extensions for people who are currently certified in the program. And we started a wait list for people who were contacting us, trying to enroll in the program, and we couldn't serve them yet. Luckily, those physical presence waivers were granted pretty quickly. So we were pretty quickly able to contact all of the families on the wait list and be able to get them scheduled for a certification for benefits. But there was a little bit of a lapse there, probably about a week or two, where we weren't able to provide the full service that we wanted to. Although we've had our office closed now since March, we have been providing some of those curbside services. So we have been issuing new WIC cards via curbside service, and we've also been providing some materials such as breast pumps or education materials to families through curbside service. During the COVID-19 pandemic and transition for our program, we have had great leadership from our Wisconsin WIC office, or state office. They worked very quickly to make the adjustments to the certification system for us that we needed to have in place in order to complete remote visits. And they also provided us very detailed communication on how to document everything for that remote visit so that people could get their benefits from the program. The pandemic highlighted a couple of components of the Wisconsin WIC program that were very valuable. And I understand that these components of the Wisconsin WIC program, although sometimes shared by other states, are not necessarily universal among other WIC programs. So the first really great component of the Wisconsin WIC program was that our certification system in Wisconsin is web-based. This allowed staff to access the system remotely. And when our offices closed down in March, the directive was that all staff who are able to start working from home. So having the certification system be web-based, we were able to accommodate that for our staff to help with their safety as well. Another valuable component of the Wisconsin WIC program was with our WIC card, the EBT card. For Wisconsin, it is a magnetic strip card that can be loaded without the person being present in the clinic. So although I love that rover idea that Brian shared from a clinic in New Mexico, we were fortunate to not need to do that in Wisconsin. We have been loading benefits remotely for some time now. And in our program in Madison, Wisconsin, we have been providing some telehealth services for non-certification appointments since October of 2019. So we did have some experience with telehealth before we had to transition every appointment that way. The pandemic also highlighted some challenges. The WIC program really needs to modernize. We didn't have the technology set up to have really effective visits with participants initially. We are just getting started with doing more virtual visits using video and Zoom, but primarily it's been over the phone, which is sometimes challenging to build rapport with people. Also during the pandemic, we've modernized in a couple other ways. It may seem silly, but we needed a new way to monitor our voicemails coming in and dividing out that work. It's one of the details that sometimes gets missed, but we were receiving a higher volume of phone calls and we needed to keep up with the voicemails. Also, we have been implementing an electronic software to allow for participants to submit documents and sign documents electronically. This has been a great asset for our program. One thing that would be so great moving forward is if we have a software system to allow the document submission that is also linked up with our certification system, because right now we're using two different systems that aren't communicating with each other. The ability and flexibility to work from home was also an adjustment that has helped maintain our WIC program in Madison. I don't think we would be able to staff our clinic as well as we have been if the physical presence waiver wasn't extended, because we have a lot of families, we have a lot of staff who have families at home and young families who they're also managing remote learning for. So those staff, if we couldn't do the remote visit, they would likely be taking time off to help their families. As Brian mentioned, there's been double-digit caseload increases in some states. Locally in Madison, Wisconsin, we have seen a 12% increase in our caseload, which equals approximately 500 people. Most of the increase has been with children, and like Brian mentioned, most have been families that we've served before in WIC. While it's great to see that people are seeing WIC as a resource, I do know that there are a lot of families that we are not reaching just with the economic situation in our community. I think there are a lot of people who either don't know about WIC anymore or they don't know that they might be eligible. So that is a significant challenge that we have in communicating the value of WIC services. Again, happy to be with you all this afternoon and look forward to questions. Thank you.
Fantastic. Thank you so much, Katrina, for that great overview of the important work you're doing at the local level and some of the challenges you're facing. I'm going to turn it to Elyse now for any words that she wants to give before we dive into more conversation.
Thanks, Allie, and thanks, Katrina, for that really important perspective. And thank you, everyone, for being here today. I'm going to just shift for a moment to talk about the WIC shopping experience. So with COVID, we, of course, layered a new set of challenges on top of those already present in the WIC shopping experience. And there continues to be a real sense of urgency. On the one side, there was this explosion of curbside and other options that became available to lots of different kinds of shoppers. And there's the rapid expansion of the SNAP online purchasing that Brian mentioned. But then the question is, who was left out of those options? And then on the other hand, there was what we're hearing from WIC participants. So the kinds of questions that agencies were getting and in the data that state agencies collected for participants early in the pandemic. People want other safer ways to shop. And, WIC participants, like everyone else, want and deserve to protect the health of their families. And they shouldn't have to choose between keeping their family safe in the context of COVID and accessing WIC's healthy food package. The good news is that WIC and WIC retailers can work together to create systems that support them in doing both. And I really think this is an incredibly important moment of opportunity for WIC and its retail partners to support more equitable shopping experiences and address some of the geographic, racial, and other disparities that persist in this space. So I think, like in terms of online purchasing that Brian mentioned, the legislation he mentioned, I think that's a really important step to urge a move in this direction. But it's also important to think about what can and in some places is being done now in terms of online ordering with an in-person pickup. So this option does not depend on regulatory changes. It's something we can do right now. So many WIC only stores were able to pivot to an online order option more quickly, and in several states they did so early on in the pandemic, which is great. And then a handful of traditional grocery stores are making available WIC online order with in-store curbside pickup, or they plan to. And I think, I would just flag that I think the moment is really ripe for data gathering on these efforts. Some wonderful researchers out of the University of Tennessee recently ran an online ordering pilot with a regional WIC retailer and gathered some really rich data from the perspective of WIC shoppers, as well as retail staff. And I think it's so important to incorporate both of those perspectives here. And then, I think, it's essential to keep equity in the front of our minds as we are designing a better WIC shopping experience and one that's accessible to all. So I'll just mention a couple of examples. Thinking about people in communities without WIC retailers who could readily offer an online option, who don't have that available for any of their shoppers right now. And another is grandparents raising grandkids, people who might not initially feel as comfortable accessing the technology that they need to do an online order. So just to wrap up, two kind of additional thoughts. One is, and other people have referenced this in other ways, but I think it's worth repeating, like the limited utility of temporary waivers in this space. So some states recently received a waiver for the requirement for the WIC transaction to occur in the presence of a cashier. That's exciting, but temporary waivers don't offer the kind of certainty that WIC retailers need to make an investment in this technology. And so I think there's a real need for long-term reforms here. And then I think this conversation also requires us to revisit the food package itself and think about what changes we can make so that families can get the most out of their WIC benefits. So the kind of food package flexibilities, I think, give us a lot of food for thought, as does the possibility of an expanded cash value benefit. I think that's it for now.
Fantastic. Thanks, Elyse. That was a great overview of some of the innovation on the shopping experience front. And thank you again for bringing up the equity issue. I think that's really important for centering our conversation. And with that, I'd love to move now into a panel discussion. So and Elyse touched on, and Brian, both, or everyone really touched on the waivers. And so I'd love to dive in there a little bit more, in that we know these waivers have changed for at least the moment, how the program is administered. And so thinking about how might these temporary waivers change the program in the future, and what else do we feel, or do you guys feel, or is needed to best serve families during the pandemic and potentially beyond? And feel free to jump in at any point. Everyone can dive in, and then if we have to, I can pick an order, but would love to hear from all of you.
So a couple of things. So with regard to the temporary waivers and how they can change the program in the future, I think it's just making WIC more convenient for families. Most of the families who participate in WIC are working families, and we talk a lot in our clinic about the transportation barrier that families have in coming into the program. So these waivers just eliminate that barrier that some people have for transportation, navigating buses, trying to find rides, paying for a taxi. It is all very burdensome for families just to receive some WIC benefits. So I think that change would help us tremendously, just getting rid of that transportation barrier. I think with regards to the second part of this question, what else is needed to best serve families during the pandemic? I think just the additional technology for our WIC programs, so we can continue to modernize. Also, another thing that we talk more about now, because we're providing remote services over the phone, is what happens when someone doesn't have reliable phone service now? And we know that that is definitely an area of concern. Some families have a phone, but it's only a phone that they can make outgoing calls with. So how do we reach them for their appointments?
Yeah, I co-sign a lot of what Katrina said. You know, I think when we talk about particularly that last point around phone and essentially broadband access as well, I think that plays out in, you know, the clinic setting and being able to operationalize a lot of both remote certifications, but remote nutrition counseling. And it also plays out in the vendor context as well, because rural vendors in particular need access to broadband to conduct the EBT transaction. And so when we're talking about equity and we're talking about serving, you know, tribal populations and rural populations, being able to support those small vendors is a big part of the equation. And, you know, I think it's no surprise to policymakers that rural broadband is an issue that needs some more attention moving forward. You know, I think one piece as well is to zoom out and, you know, think of WIC, and WIC stands at the intersection of food security and public health. And, you know, I think sometimes we don't recognize, and we're kind of going in our own lane, that we don't recognize how WIC can bridge those two worlds. And so, you know, I think in the food security aspect, you know, we are in an economic crisis right now as a result of COVID-19. And there are families going hungry. There are families with young kids who are going hungry. And, you know, we talk a lot about how that we just need to boost up the purchasing power of families right now to ensure that they have access to enough food. Of course, a key part of that is SNAP. We do not dispute that, but we also think that there are levers that can be pulled in WIC to expand the cash value benefit. It is the easiest way in our system to provide additional food benefit for people at this time. It also keeps an emphasis in the public health side of, you know, nutritious food for families. And it's consistent with where the food package is going. And, you know, I think we can expect over at the USDA side that they'll review the food package in the next year, since the dietary guidelines process is wrapping up. And based on both the dietary guidelines and the 2017 report from the National Academies of Sciences, additional fruits and vegetables are in WIC's future. So there is a provision, bipartisan, has been included in the House COVID bills that would extend triple the benefit of the cash value benefit for a period during the pandemic. And we think that's an important step forward. I'll stop there. That I could talk forever about this issue, but I'm sure Madeline and Elyse have ideas as well.
The thing I was going to say was about the food package, so I'll jump on there. And huge agreement on the cash value benefit, and that's something I would so love to see. But I also, you know, one other thing that I've thought about is, you know, the food package flexibilities that were introduced, and hopefully have made it easier to shop for WIC. What if it always looked like that? I think one of the challenges and things that can make it kind of hard to shop with dignity for WIC are some of the very complicated rules on package sizes, and it leads to some of those like issues around stigma in the store at checkout and things like that. And I have to ask myself, what if we designed a food package that was very healthy, but also kind of allowed all WIC participants to shop with dignity, and to just make it an easier experience.
And I would just echo what Katrina was saying with the current barriers that exist with transportation and getting time off work to have families visit a WIC clinic, and that these waivers have really helped lessen those barriers and make it easier for families to participate. So going forward, it would be great to have some of that flexibility in the program to kind of reduce those barriers to entry.
That's great. Thank you guys so much for your thoughtful responses. One question that I have is whether there have been any drawbacks from the waivers. In some of the work that I've been working on with some different states, particularly states that feel like they have more touch points with participants, that really value the sort of customer experience and the customer service elements of the program that they give, have been thrilled that programs have been able to be administered, or appointments administered remotely, but also sort of have been thinking about how they change and promote that sort of customer experience element, given that they don't have that face-to-face contact. And I'm curious, Katrina and others, to the extent that you hear that you've seen that, or if you've seen other drawbacks. And as I ask this question, I also just want to invite the audience, again, feel free to submit any questions in that chat box as well. We're definitely going to save time for those at the end.
Thanks for the question about the drawbacks. The waivers have been fantastic, but not without some kind of other consequences to the participant experience. As I mentioned, we are still trying to get up to date on use of technology. I think one of the benefits of in-person appointments is that we sit with the person and we pick up on the nonverbal communication that they have in the clinic. Pauses are a time when we can just kind of connect and see how they're doing. At this time during the pandemic, mental health has been a significant concern for a large portion of the population. WIC not only provides healthy foods and breastfeeding supports, but WIC is also instrumental in referring people to services such as mental health services. And without having that in-person visit, the conversation around mental health and asking to see if they may need a referral to somewhere has been a little bit more challenging for program staff to navigate. And I think we have been missing out on a lot of those referrals that we could be making, again, at a time when so many people are challenged with the state of everything during the pandemic.
That's great. Thank you. Or Brian, were you about to jump in?
Yeah, just to build on that
please.
point, because I think, WIC is a hub, right? And, again, being at that intersection of food security and public health is that, I think the referral piece is our ability to connect folks with the health services that they need. And in addition to mental health and, both mental health of going through COVID right now, but also postpartum depression as well, I think is a big piece. But substance use is another big piece as well. And substance use during pregnancy, as we all know, can impact the health of the child. And so we're doing a lot of work on opioid use right now and developing materials, uniform materials about opioid use and withdrawal. And, there are a host of other intersections. And I think one point to draw from this as well is that, the in-person touches, both in the sense of identifying referrals, in promoting breastfeeding and, being there to build that relationship with folks is, critical in complementing the work of the primary care physician as well. And I think Madeline really pointed to some great ideas around how we can enhance our collaboration with and further integrate with healthcare. And I think that is, where the program is moving. And we need to get those systems to talk to each other. And we need to make sure that folks are not duplicating tests, but that information is being shared. WIC and providers can work in partnership to support the whole holistic health needs of families. And that's what families need at this time.
Fantastic. Thank you, Brian. And in the interest of time, I'm actually going to skip ahead to audience questions. I realize, and I can't believe we only have 10 minutes left of this panel. I was much more ambitious than that. I wish we had 2 hours, but alas, we have to end on time, I'm told. So I'd like to start at the top of the chat box. We have a question from Bill Nichols. Are there specific changes that would make retailers more likely to participate in WIC, particularly those that might reach participants in food deserts?
I guess Brian might have to support here, but you know, I mean, I think there you're talking about your Dollar Generals and things like that. And I think, you know, in the context of the pandemic, some of the minimum stocking requirements, I believe, you know, were waived, and you know, looking at some more flexible options in that area might make those stores more kind of accessible in terms of participating in WIC. And I think, you know, a study came out this year, last year, around like looking at this, which probably everyone else on the panel might be able to tell you more about. But I think that there are probably some good opportunities there. I'm sure others will have something to add.
Yeah, I think, you know, Elyse is spot on. I think one of the biggest barriers are minimum stocking requirements, which, you know, especially I think with certain food products like formula and with baby foods, that can hold back smaller vendors from exploring. And I mean, there's quite a disparity between WIC and SNAP here, where SNAP, you know, has a lot of convenience stores and smaller vendors and bodegas as authorized vendors. With WIC, I think it's about 70% are large national chains or regional chains. So there's quite a big difference between WIC and SNAP there. One other piece I would say is technology as well. WIC is seen in the vendor community as such a small slice of the pie. And retailers do have to lay out some funding to get the integrated system between SNAP and WIC to run those EBT cards. And frankly, you know, the WIC EBT is still such a new innovation in spaces. You know, a number of states rolled out in 2018 and 2019. And then the pandemic hit, and a number of retailers just kind of raised their hands and said, you know, we're not going to do this. We're not going to become WIC vendors. And so, you know, I think especially as we explore additional shopping options ranging from, you know, an in-store or curbside pickup to a online purchasing solution, that may also impact the cost of maintaining WIC transaction systems. And that may be an area where, you know, maybe Congress might have to come in and provide some funding for small vendors to ensure that there's continued participant access.
Awesome. Thank you, guys. I'm going to jump to a question from Terry Meehan, who I actually spoke with this morning, and we talked about this very thing. So this is a question that I often like to ask, because it's akin to, like, if you could wave your magic wand, you know, what would you change? What would you do? And in this scenario, you know, in a world where we could increase funding to WIC, you know, doubling funding to WIC, what do you expect would be the impact? What percent of eligible families do you think would be able to participate? Would you be able to provide more nutrition support, more technological advances for the program? You know, what do you think would be the impact? And also, you know, what would be the best use of those kinds of resources?
I'll hop in here first. And if I had a magic wand, I think it would be a highlighter that I could use on the Child Nutrition Act. But that being said, I think one of the biggest challenges in WIC that we've seen over the last 10 years is that with declining caseload, it's really illustrated the challenges of the statutory WIC funding formula. And, you know, there is about, you know, 70% of what is allocated for WIC is solely devoted to food and breast pumps. The rest is not only for administration, but for all of our public health programming as well. And so I think that that funding formula doesn't realize the modern needs of the WIC program. And this is a challenge that we've dealt with for the last 10 years. And, you know, I think we'd love to explore legislative solutions around But it is also very complicated, and it goes to the heart of the question of, you know, there are folks that view WIC as simply a food distribution program, and there are folks who see WIC for what it is, which is a public health nutrition program, standing at the balance of food security and public health. I think these areas need investment. We need technology. We need to be able to retain our credentialed staff, our RDs and our IBCLCs. We need to do outreach to to eligible families who are not participating. And we need to invest in robust nutrition education and public health services. All of that I do not dispute. But I think given the restrictions in the funding formula, we need legislative change paired with new investments. And I think that that is a balance that's difficult to strike in such a narrow partisan DC right now. And hopefully we find bipartisan compromise on this, but it's a difficult area right now.
While I have you, Brian and Madeline, maybe this is something you can also speak to a question from Claire around the change in administration. You know, what can we expect to see on the horizon, maybe? And just a very brief response. Sorry, I have to cut you off, but it's 4:27 or my time. We're almost at the half an hour mark. So yes, be brief if you can. Thanks.
Well, I can start by saying one thing we definitely expect to see in the next administration is finalizing a new WIC food package, which is something we've been waiting for and have, you know, felt that waiting for the next dietary guidelines to come out did make sense, but we'd really like to see those changes be put into place. So excited about that to come in the next year or two, hopefully.
Fingers crossed. And I do think, just building on the food package concept, I am hopeful that the next administration will pick up on both online shopping and healthcare integration as priorities for over the course of the next 4 years. And I should point out that all three of those priorities for a Biden era USDA are not necessarily partisan priorities. They are likely would have been on the agenda should Sonny Perdue have remained USDA secretary. And you know, WIC continues to build its bipartisan support and be available for families across the country.
Fantastic. Thank you for that response. And thank you to Dwight for reminding me that we are coming to a close here. So just a few closing thoughts. And Dwight, I don't know if you need to jump in here as well, but I just wanted to take a moment to thank our sponsors and for all of you for attending this panel today, and particularly to all our panelists, Katrina, Brian, Elyse, and Madeline, for participating today, sharing your insights. I feel like I know I walked away with something new, and so just really appreciate you taking the time to have this conversation today. And with that, I think I kept us on time, so I can check that box. Thank you guys again. Have a great rest of the conference, and best of luck. Have a nice night. Take care.